experience with primary and metastatic large or small cancers from head to toe. Cancer treatment with possibly a second chance for you, even if chemo, radiation, or surgery didn't work or isn't tolerated. Our goals are best results and quality of life. Meet Dr. Lederman to hit the cancer. For a free booklet DVD called 212 Choices, 212 Choices for a fresh second opinion. Most insurances, Medicare, Medicaid, accepted. Not only super convenient, super. Broadway and 38th in Manhattan. To hit your cancer, see Dr. Lederman, 212 Choices. With Dr. Lederman, the best prostate cancer treatment is custom tailored for you. Each man with prostate cancer is unique and seeks the best results based on PSA, Gleason score, and stage. That's why Dr. Lederman's custom-tailored prostate cancer treatment is most logical. Not every man should get the same treatment. Dr. Lederman's custom prostate cancer treatment is all outpatient. Our goals are your best results, avoiding radical surgery, maintaining your sexual and urinary function, and your life. Most insurances, Medicare, Medicaid, accepted. Call Dr. Lederman at 212 Choices, 212 Choices for a fresh second opinion and free booklet DVD. Not only super convenient, super in Manhattan, 38th and Broadway. To hit the cancer, call Dr. Lederman, 212 Choices. Cherish your life. Custom prostate cancer treatment with Dr. Lederman, 212 Choices.
Welcome back to the Radiosurgery Hour. This is Rob Redstone here with Dr. Gil Lederman at the WABC studios in the heart of New York City. We're just a few steps from the Radiosurgery New York Cancer Treatment Center on Broadway and 38th Street. Dr. Lederman, the leading cancer expert, treats prostate cancer non-invasively. He was the first in New York with fractionated brain radiosurgery, and he's the first in America and in the Western Hemisphere with body radiosurgery. Hey, Dr. Lederman, we're back.
Hey, we're back. We have a phone call, so let's take it. Good morning. You're on the air. How are you today?
Good morning. My name is Michael. I'm listening to the program, and cancer runs in my family. On my mother's side, it's the prostate. I'm an African-American, and I know that's a big problem with men.
It's a big problem, and the mortality rate in blacks is double whites. And so if you're a man and you got a family history, you need to do something about it.
Yes, I go for my PSA every year.
Good.
And I'm 50.
What's your question?
I've been doing it since I was 38, and I'm negative.
Okay.
And I said, I am not going out that way.
Praise the Lord and pass the ammunition.
Yes, and my oldest sister, she died from colon cancer with metastases, and it went to her liver, and that was a hell on earth. I had to watch, and she died at 52.
You know what we're fighting. You know what we're doing. If you saw your sister die, you know what we're fighting. And I talked about a case earlier in the hour where the insurance company wanted the man to go on a hospice and die, and he was in terrible pain. And we treated him a year ago, and he's had a great year. He walked in the office yesterday. So we're fighting every day. What's your question?
Yes, I just want to know what steps can I take that I don't get it?
Well, come in, and the best thing to do is to come in. We'll sit down, as my grandfather said 40 years ago to the doctor, come in, close the door, sit down, and stay a while. And that's what we'll do with you. We'll go over your case. We'll look at the records. Yeah, you've been told certain things about your PSA and so on, but we want the proof, and we want you to have copies in your hands. So we want to give you a clean bill of health if you deserve one, and if you don't, to find out what's wrong and fix you up. So the best thing is really to come in. Advice over the telephone is not worthwhile.
My PSA is negative.
Well, there's no negative, okay? Negative is minus 0.5, which doesn't exist. So it doesn't. Do you have the paperwork of your PSA?
I can obtain it.
Well, that means you don't have it, okay? So what I tell you is come in and stay a while. So many patients have been told it's negative. There's no negatives in PSA. It doesn't exist. There's a number. And you need to know what the number is. You need to know what the trend is. What was it 10 years ago and 5 years ago and 2 years ago and today? That's what you need to know. There's no negative. Those numbers don't exist. And when someone tells you that, it's gobbledygook.
Wow.
So come in if you wish. Come in and we'll look at you seriously. We'll look at the trend of the PSAs. We'll examine you, go over your family history, and work to make sure you're always healthy.
Yeah. Okay, can you send me a DVD?
Yeah, but I'm on the radio. You're talking to 50,000 people right now. So call it 212-CHOICES. Call during the week is best, 212-CHOICES, which is 212-246-4237. We'll mail it to you. And you can always call me. I'm happy to talk to you. But the best is really to come in and let's spend some time together.
Okay.
All right. God bless you and have a great weekend.
God bless you.
Bye now. So we treating several patients with hyperthermia. We're one of the few facilities that use hyperthermia, which is heat, actually. We can heat up cancers, and there's been studies, actually, since the time of Cleopatra. It's been known that heat helps kill cancer when given concurrently with some other treatment, usually radiation, radiosurgery, even chemo. But hyperthermia potentiates other treatment. So for some breast cancers, we have many women with big breast lumps. They weren't diagnosed in a timely fashion. We can use heat on the breast or heat on the skin tumors. So hyperthermia is another modality. We try to find other modalities that are real modalities, paid for by insurance. By the way, we take most insurances, Medicare, Medicaid. We're a private cancer center, which means we know you. It means that we're working for you, not the drug companies. And there's been lots of exposés showing how the drug companies are paying hospitals and cancer hospitals tens of millions of dollars. And the whole question is, how does that sway a doctor's opinion? Some people come to us and say, hey, all the doctors want to give me chemotherapy. Well, then we say, do you know the hospital's getting tens of millions of dollars? Maybe there's a conflict of interest there. Good morning. You're on the radio. This is Dr. Lederman.
Yes, good morning, doctor. I have a question for you. I have a 63-year-old sister who was diagnosed this past October with primary peritoneal cancer.
Mm-hmm.
She had gone in for surgery, and the omentum was removed, and the doctor chose not to remove other organs at that time because she was filled with small, like a popcorning effect of cancer cells, he had said. She
Sorry to hear that.
recouped from surgery and then had 18 weeks of chemo. This past Thursday, she had a second surgery to have a hysterectomy to remove the other organs. And when the doctor went in, there were still hundreds of small cancer cells.
Sorry to hear that.
Thank you. So he chose not to do the hysterectomy, just take some biopsies and close her up, and now offer her a different chemo combination.
Right.
My question for you is, does your procedure focus on certain organs, or would you do an entire abdomen in a case like this?
Well, there's lots actually to discuss, and we're actually near the end of the hour. But just to give you an idea of different things we do, if the chemo that she had didn't work, probably the chemo's not going to work because the cancer starts outsmarting the chemo. I'm told I have 30 seconds. So give me a call at 212-CHOICES, either after the show or during the week, and I'll tell you about other options. We sometimes biopsy the cancer and find custom-made chemo for her. Sometimes we give chemo in the abdomen. Sometimes we do abdominal treatment. So give me a call and we'll talk about her, okay?
Okay, super.
All right. God bless you. Bye-bye. We're at the end of the hour. We hope you have a great weekend. If you have questions, I know many of you do because we've had many other calls. Call us at 212-CHOICES. We'll send you a booklet. Have a great week.
Thanks
God
for
bless
tuning
you.
in to the Radiosurgery Hour with Dr. Gil Lederman and myself. If you have questions before next week's show, just contact Dr. Lederman at 212-CHOICES. That's 212-246-4237. That's 212-246-4237. This is Rob Redstone. Till next week.
Here's Dr. Gil Lederman, New York's only Harvard-trained, triple-board certified radiation cancer doctor. If chemosurgery or radiation isn't working or isn't tolerated, when cancer and its pain and symptoms aren't getting better, seek a fresh second opinion at Radiosurgery New York's Urgent Cancer Consultants for innovative, custom-tailored cancer treatment. See our experts within one business day because we know your time and your life are precious. Our goal is proper diagnosis and effective, non-invasive outpatient treatment. Decades of leadership, first in New York with brain radiosurgery, first in America with body radiosurgery for cancers of the brain, body, and prostate, all custom-tailored for you. Call 212-CHOICES, 212-CHOICES for a prompt appointment and free booklet DVD. Super convenient, 38th and Broadway, with most insurances, Medicare, Medicaid accepted. You're next at Radiosurgery New York. Just call 212-CHOICES, 212-CHOICES.
You know, when you're talking the big C, cancer, a lot of times people have gone through prior chemosurgery or radiation and it just didn't work or didn't get the desired effects. All of a sudden you want to get an opinion on what to do. Well, Dr. Gil Lederman treats not only newly diagnosed and recurrent cancers anywhere in the body, but definitely will specialize with those folks who have already been through a process that didn't work, and now they're trying to reconfigure in terms of what they can do, and he goes one-on-one with you. In fact, he'll send you an informative booklet, DVD, and arrange a prompt meeting to discuss all choices at his convenient office located on 38th and Broadway in Manhattan. He's a brain and prostate cancer as well as body cancer expert, also treating breast, lung, pancreas, liver, kidney cancers, and more. And back in 1991, I referred my dad to Dr. Gil Lederman, and he came up with a solution for his medical problem. Harvard-trained radiation oncologist first brought non-invasive stereotactic body radiosurgery to America. He has the longest experience treating cancer using radiosurgery with no cutting, bleeding, anesthesia, or hospitalization. So just call Dr. Gil Lederman for your cancer treatment choices at 212-CHOICES. Write that number down if you want to refer someone to call, or call Dr. Gil Lederman for that person at 212-CHOICES. That's 212-CHOICES.